So from meeting kind of parents, teachers and other professionals over the years, I suppose kind of having access to information was always a kind of key priority of theirs. So we wanted to kind of create a place where we could kind of put up information that was easily accessible. Obviously a lot of people communicate online now, so we kind of put together some resources. So I suppose across Cork and Kerry there's a lot of different primary care occupational therapy departments, so it was about gathering, you know, the referral information, thinking about what information parents would appreciate to have, I suppose, accessible to them. We basically set up a web page on hc.ie, and it's a place where parents can go to get information about what is occupational therapy, how they can refer to the different occupational therapy departments in Cork and Kerry, and also then I suppose the key part is putting up information about kind of tips and strategies to kind of help parents and teachers. Staff in the primary care occupational therapy departments are really happy with it. I suppose it's great for us that we can refer to it a lot in our sessions. We've put up the link to the webpage in all our therapy waiting rooms, and we've sent it to schools as well. And parents find handouts very useful for, I suppose, again, access to information. So in general, I think the feedback has been good so far. Great, I suppose the nomination I'm delighted with, and obviously I represent a lot of staff across Cork and Kerry that are working to improve access to the service, and I suppose it just shows that the webpage is I suppose beneficial, and I suppose people appreciate it, and it is just, I suppose, an easy way for parents to kind of get to us, I suppose, and the information is up there, it's clear and easy to access.
Back in 2017, the service that I would have worked for historically had a long waiting list that was piling up. It had reached almost 4.5 years long, and as a result of that it actually had caused a lot of frustration among people waiting on the waiting list for services. The team felt a bit overloaded in terms of being able to manage it, and obviously we were under pressure in terms of to reduce the numbers and to see patients. And it kind of brought up issues in terms of who was considered, you know, getting access to emergency care. There was a large number of referrals for autism spectrum disorder, or children who'd have a profile that would be similar with someone who had an undiagnosed autism spectrum disorder on the waiting list. So what we did was we arranged, I suppose, set up appointments and a system which would allow us to flag children who had those difficulties, and I suppose to expedite their referrals to our service. We identified a screening tool that we could use. We actually linked with the local ASD services to kind of find out one that would be useful. Through using that screening tool we were able to identify children on the waiting list and prevent children that were being referred into us from going on the waiting list unnecessarily. As a result of that, within a few months we managed to reduce the waiting list by almost half, which was a huge success for the team, and kind of once it got to that level we realised it was manageable in terms of preventing it from increasing again, but also in terms of, I suppose, identifying other ways of reducing the waiting list. Well, I suppose the level of frustration of people on the waiting list is much reduced. GPs are referring to us now more freely and able to contact us more directly because we have that availability to be able to liaise with them. About new referrals coming in, because we're screening children and able to refer them in the right direction, I suppose what we're finding is that people would be sitting on the waiting list, and then when they would come in for assessment and were seen for assessment, they would, I suppose, then become frustrated because they'd realise, actually, look, this isn't the service we should have gone to in the first place, whereas we've managed to prevent a lot of that from happening. So I suppose as a result of all the work that we've done in terms of reducing the waiting list, what we've been able to do is to it's reduced the numbers that need to be seen by us, but it also means that we're able to get to the children that actually need to see us for their mental health difficulties, and we're able to get to them much faster and provide, and I suppose provide a better service.
Our team here from Cork Disability Services Office and the Kerry Disability Services Office, led by Kate Cronin, gather information in relation to those who are leaving second level school, moving on to the next phase of their life. Well, it has a huge impact on all those who we support, approximately 330 people this year that we'll support in terms of them getting access to services and to proper educational supports as they move on post-leaving cert. The process has huge impact on the lives of those whom we support through the office here. We make sure that they have access to services for the next number of years going ahead, and we help them to achieve their full potential as they head into the young phase of their adulthood.
It's for young people or young adults who complete their education in mainstream schools or special schools, and the HSE provides funding for them to go on to do rehabilitative training or day services, and they provide supports for the young adults. Across Cork and Kerry, we placed about 320 people into training centres and day service placements. We were very happy really to find out that we were nominated for this award.
I've noticed that when you get to talk to parents, that they are delighted that there is a service there for their son or their daughter when they leave secondary school, and that there is a support service ongoing for them, and they are very happy. So the process works across Cork and Kerry, and the team we'd be both Cork and Kerry. It's fantastic, yeah, great buzz around the office. We're very happy. We didn't expect it at all, but we're delighted and having a big day out down in the Kingdom.